When we look at the value of N, the number of components that the molecule can dissociate into. Like I said, sodium chloride can give you sodium N chloride. So you would think it's actually going to be 2 for sodium chloride, because one molecule of sodium chloride gives you 2 molecules of, or 2 atoms, one of sodium and one of chloride. Well, but it's not always the case, because if you look at real life, or in reality, if you take 100 molecules of sodium chloride, that all those molecules aren't going to break into 200 molecules. It does not. It's supposed to be 200 different molecules, total atoms or ions, but it doesn't happen like that. Not all the molecules of sodium and chloride will dissociate. What's going to happen instead is you will maybe get 188 molecules of total ions. So some molecules dissociate, some of them don't. When you take 100 molecules of sodium chloride, this is important to remember. So there is a value given for different ions and their solutions, which you can always refer to if you ever do these sorts of calculations over there. Okay, so we spoke about NCRT and the fact that the number of these the individual molecules or atoms are what determine the osmotic pressure over there, and so that's why it's called the colligative property. And the other thing you should know is that there's another constant, another factor over here called sigma, which I've put in this formula. So what is sigma? Well, now look at this. Let's look at this formula again. P is equal to sigma NCRT, which we are familiar with in all these things. Now, what is sigma? This is the question, this Greek alphabet of sigma. Now, let's consider again that there are 2 compartments over here, compartment A, compartment B, and we have the fluid over here, and it's equal, and then you add some salt molecules in A. Now, these 2 compartments are separated by a semi-permeable membrane. Now, I want you to understand that not all salts stay on the same side of the membrane. Sometimes there will be that one salt that just makes it through to the other side over there, while the others, instead of going across, they bounce back. They are reflected back to that compartment. So some of them will make it across the membrane, while some of them are just reflected back to the same side of the membrane. Now look at this. If you have some salts moving to the other side while the others are reflected, is it going to be an effective molecule in terms of driving the flow of water to that side? Not always, not necessarily. Because look, if the salt stays on the same side of the membrane, okay, that's good. You've got this one. You've got more attraction of water over here. But if the salt molecules start to migrate to the other side, now there's not enough water that's going to move to the other side. So that's why some molecules are good for staying in a compartment and expanding that volume of that particular compartment compared to others. I'll give you an example. If you take a molecule like urea, for example. Now, urea is going to eventually cross the cell membranes and enter the cell. So in the beginning, when you put urea in one compartment, it attracts the water to that compartment. But as the urea goes into the other compartment, it's going to drag water along with it to the other compartment also. So it's not such an effective osmotically active particle. It's not osmotically active. So there are also these urea transporters that can take urea into the cell. So I'll talk about that in some more time. Okay, so what is the chance that a molecule can bounce back and stay in the same compartment, meaning being reflected back to the same compartment, versus going to the other side of the membrane? This is known as sigma. Sigma refers to reflection coefficient, and so that means what is the chance that the molecule would bounce back into the same compartment instead of crossing over to the other side? Now let's just say that if you have all the molecules in this formula, sigma NCRT is equal to P, if all the molecules stay in the same compartment, nothing crosses over to the other side, that means you have the full calculated force of osmotic pressure. Its value will be the same as you calculate, so sigma will be 1 because it's 100% reflected back. So the remaining NCRT you can just calculate. However, some membranes, what happens is some membranes are permeable to certain small atoms or molecules, and some of them will cross over to the other side over here. So if some of them cross over to the other side and don't stay in the same membrane, then this formula NCRT is just the value of the pressure will be reduced. Let's say that you have 10 molecules of salt over here, 1 2 3 4 5 6 7 8 9 10. Now what's going to happen is, let's say that half of these molecules will reflect back, but the remaining half will cross to the other side. So what happens now? If half of the molecules go to the other side, the reflection coefficient is 50% or 0.5. So the osmotic pressure you calculate is going to be half of what could have been if all the salt stayed in one side of the compartment. So this is your reflection coefficient over here. And we should also discuss about a concept called tonicity. Tonicity refers to how much of concentration of these solutes exist in a solution, and when you compare it compared to that in the cytoplasm of the cells, and usually we use the RBC as the reference type of cell. So what does that mean? Look, your RBCs, for example, are floating in the plasma, which is part of the ECF, in the blood vessels. Remember the body fluid compartment. So ECF is on the outside, and in this case it is the plasma. And the cells have a cytoplasm. Now we know that this RBCs have a special shape called the biconcave discoid shape over here. Okay, and what happens is this shape is maintained because the number of osmotically active particles outside the cell and inside the cell are exactly the same. The composition might be different, but the number of particles are exactly the same. So because the concentration of the different osmotically active particles are the same inside the cell and outside the cell, there is no difference in the osmotic pressure. It's balanced over there. So we call these types of solutions isotonic solutions, where they are equal and balanced. And if you look at the situation where, for example, you add some more salt into the blood, or you change the osmolality of blood, what's going to happen then? You give some IV fluids which are hypertonic with a lot of salt over there. a lot of salt, a lot of different ions over there. So this has got more concentration than the normal blood fluids. So what happens now? You increase the concentration of salts outside the cell, and we call this a hypertonic solution. Sometimes you get something called hypotonic. Hypotonic is when you have less number of molecules outside in the solution compared to in the cells. Like when you give hypotonic sodium chloride solution, you can give that IV, so half strength of what we call normal saline. You see, normally when we say isotonic, that's the normal osmolality of a normal person's blood, and that's based on the number of moles of particles per liter or per kilogram of the fluid. And if the inside and the outside of the cell matches, or two different compartments, the number of salts match, they are isotonic. So this tonicity is calculated by the number of moles of a particular substance which you put in one side of the compartment, which stays in that compartment, divided by the volume of that compartment which the salt is in. And this is what we call osmolarity. So osmolarity is where you divide the number of moles by the volume. Okay, so think like liters, volume, liters. Riti, R sound, is where the denominator in the formula is liters. Liter. Okay, so that's important. Now the other way you can express tonicity of a solution, or the concentration of the ions, the osmotically active particles in the solution, is using a concept called osmolality. Osmolality is the number of moles of a substance divided by the kilos, meaning the weight of the solution in kilos over there. Okay, so liti has kilo, LL sound. That's how you remember this. Now, what's the difference? Osmolality is more accurate. Why? Because it's based on the weight of the fluid, not the volume. You see, volumes expand and contract with different temperatures. So if your body temperature expands or contracts, the volume will change accordingly. However, if your kilos of water is the same, it will be the same whether you make the solution cold or warm. The same number of molecules that make up the same amount of weight will be present over there. So this is how you compare osmolarity versus osmolality. Osmolarity changes with temperature. Temperature affects it. Osmolality, temperature doesn't affect it. So you don't need to take temperature into account. Now, remember the Darrow unit diagrams which we did before. So imagine if you give IV fluids with normal saline solution, what's going to happen? You are going to get more fluids. You can watch that video. It's already been uploaded in body fluid compartments and Darrow unit diagrams. So you can just have a look at that. The point that happens, or that you should be aware of, is that you have these fluids, and now this is your blood vessel over here, and these are the different cells also. Okay, the outside ECF, ICF. This is again from the body fluid compartments example diagram I gave you. These are your red cells over here. I just stacked them over here in one corner. So just use our imagination. Now this is the plasma over here. Now what happens is sometimes I can stick an IV line and I can inject through a drip solution different fluids, so it's hanging over there in the hospital. Just use your imagination. So these little fluids will start dripping and getting infused into your plasma. Now if the tonicity of this fluid is the same as that of plasma, how much is the tonicity of your plasma? It's around Some books say 300 milliosmoles per liter or per kilogram. It's almost the same in the human body. How much can our temperature vary? 1 degree or 2 degrees. So physiologists and medical professionals don't really make that much of a difference or a distinction between osmolarity and lity, but we like to use the term osmolality. So let's just say some books say that 300 milliosmoles per kilogram of fluid of your ECF is considered the same osmolality in your plasma. So that's the same amount of tonicity in your red cells also, and in all your cells. All of your cells in the cytoplasm have 300 milliosmoles per kilogram, just like in the plasma, but the constitution will be different. There's more sodium in the ECF than in the ICF. There is more potassium in the ICF than in the ECF. We know this. We've discussed this in body fluid compartments. But the number of particles, osmotically active particles, are supposed to be equal and opposite and equal and balanced between the ICF and the ECF, the intracellular fluid and the extracellular fluid compartment. So, and that comes to around 300 milliosmoles per kilogram. Now, if you were to infuse a solution with 300 milliosmoles per kilogram tonicity, an example is 0.9% solution of NaCl. This is called your normal saline solution, or we have something else called Ringer's lactate solution that surgeons love and that I prefer actually. It has many more electrolytes and a little bit of lactate, which gives a few calories also to the patient. It's better for burns patients also, this Ringer's lactate. But of course, there's hardly any difference. So these come under the crystalloid infusions that we give. There's something called colloid infusion and crystalloid infusion. We'll eventually deal with this when we go to the pharmacology section, which I will be starting soon. Alright, so let's just wait for that to start also. Until then, just understand that Ringer's lactate and normal saline, well, this is 0.9% of NaCl, normal saline. Its osmolality is around 300 milliosmoles per kilogram. Now, if we look at some situations where you have to infuse lower tonicity of, so you can get some situations where you have to infuse hypotonic solutions, half of the strength over there. So you get 0.45% solution of NaCl. When you infuse this, what's going to happen? There's more water than there's salt, which gets infused into the blood. So if you infuse this, this is going to have more solvent in the plasma than in the cells around it. So the cells eventually will attract more water inside, and the RBCs will eventually swell up and become much bigger in size. You understand? Because you give a hypotonic solution. And sometimes you can get hypertonic solutions also. So if you give some solution with a higher concentration of salt or any osmotically active particle, it'll cause shrinkage of the cells. And you can even see this under a microscope. You take a bunch of cells and you take a glass slide and keep 3 different drops of fluid. One is isotonic, hypotonic, and hypertonic, and mix a little bit of blood over there with these 3 solutions. Look under the microscope and you'll see the shape of the cells would be different. Under the hypertonic solution, you get these shrunken cells which look almost like popcorn. We call them crenated cells. This is a sign that cells are, instead of the normal size, they've shrunken over here. You can see they're much smaller compared to a normal cell over here, which is under isotonic solution. So they became smaller in size, and there's membranes all like popcorn. It's all like a dried up raisin over there. We call this crenated cell, crenated, and you get these shrunken cells also. They look almost the same, not too much like the crenated cell, and but they're small over there. Then you have the isotonic solution. There the cells are normal in size. You got the biconcave shape, which is standard RBC shape, biconcave discoid shape. It's fine, nothing over there. Well, however, when you take hypotonic solution, so this is hypertonic, this is isotonic, and there's hyper. hypertonic. What is hypertonic? You have big cells, massive cells over here, and sometimes these cells burst over there and the cytoplasm just oozes out, like splatters over there. And this is like this is what they call a ghost cell.